Welcome back to the Humble Healer podcast. This is episode 16, and this is Dr. Kwanwei, board certified family physician. Today I'm wearing the Patriot jersey with Tom Brady, TB12, to celebrate the Patriots' victory today. Today I'm talking about a topic that I counsel and teach my patients every day at work. This is my passion, and this is something that I'm trying to motivate and empower my patient to take a proactive role to help with both disease prevention and treatment in both primary care and acute care settings. The topic that I want to talk about today is how to deactivate the daily fight or flight mode or stress mode to find good health, happiness, resilience, and longevity. This is something that requires a lifelong commitment, but what is more important than the return in terms of being able to live longer with good quality of life and with happiness while being very highly resistant to sickness or illnesses out there, and also be able to handle stress without breaking down. How do you get there? We'll get into that later on during this podcast. This is a two-piece series because the second part of this, I will be interview a patient of mine who volunteered to talk about the lesson that she has learned by adopting this method and has since been able to do so much better, both physically and mentally. And today, she actually, or this weekend, she's taking her medicine all day long, hiking up to Vermont with her dog and enjoying the beautiful foliage up there at this time of the year. It's going to do wonders for both her physical and mental health. So I look forward to talking to Laura next to follow up this piece or this talk today. So 25% of Americans report high perceived stress level, while another 50% reported moderate perceived stress level. Stress response was designed by evolution to protect us from danger, but can adversely affect our health, happiness, resilience, and longevity when it is activated continually throughout every day of our life. Our modern lives, with multitude of minor stressors such as unreasonable boss, heavy traffic, financial problems, can keep the stress system activated daily, eventually leading to our premature demise. The bottom line is acute stress response to an emergency situation can save our lives, but chronic stress response to the chronic life stressors can slowly erode our health, happiness, resilience, and longevity. The physical responses to stress affect most of our organ systems. It elevated blood pressure, blood sugar first, which was used to provide fuel to the hyperactive system, and also causes the release of more red blood cells and more blood to vital organs such as muscles, heart, brain, and lungs to allow us to survive emergency situations. And also it causes constrictions of peripheral blood vessels, causing elevation of our blood pressure and heart rate. And it causes also pulse quickness for rapid response, but also raising our heart rate. And it also causes airway dilation for maximal oxygen uptake to the brain to increase alertness, sight, hearing, and other senses. And it also shut down our digestion. Neurochemical responses from chronic stress lead to continuous elevation of the hypothalamus, pituitary gland hormones, such as the hormone called ACTH, leading to persistent elevation of cortisol production. And normally this fluctuates and rises in the morning and goes down in the afternoon. But because of this chronic stress response, this causes the level of cortisol to continue to be elevated and affecting our ability to rest and sleep and affecting our mental and physical health overall. The brain stress command center, the hypothalamus, exerts its stress response to the rest of the body by way of the autonomic nervous system, which controls the involuntary body functions such as breathing, blood pressure, heart rate, dilation and constriction of blood vessels, and also constriction and dilation of small lung airways called the bronchioles. The autonomic nervous system has two components. One is the sympathetic nervous system, and the second one is the parasympathetic nervous system. And the sympathetic nervous system initiate the fight or flight response. I call it the gas pedal in a car, while the parasympathetic nervous system activates the rest and digest response. I call it the brake pedal. During stress response, the sympathetic nervous system is activated with epinephrine, or adrenaline is another name, being the main fuel, while the parasympathetic nervous system has acetylcholine, as I call it the brake fluid, as a main substance, is suppressed during the stress response. So epinephrine is a main actor in this acute stress response. But in the chronic stress response, the brain activates the brain gland called pituitary gland, stimulating the release of cortisol in the adrenal gland in the abdominal cavity. And this elevation of cortisol chronically, long term, can lead to multiple adverse effects below, such as eating disorder. And please refer to the nerve gut axis episode 3, where I talk about how mental health can affect gut disorders, such as GERD, chronic reflux, gastritis, gastroduodenal ulcers or GI ulcers, dyspepsia, as well as IBS. Also, obesity due to cortisol fat buildup effect, and also other metabolic disorders such as diabetes and high cholesterol. It also causes reduced immune response, leading to more infections, just like an immunosuppressant. And it also leads to addiction due to stress response, leading to substance use disorders such as alcohol, nicotine, and other recreational and harmful drugs. We talk about also increased risk of heart attack, stroke, and other cardiovascular outcomes due to persistent elevation of heart rate and blood pressure. Cortisol also causes chronic fatigue, and the body fatigues from being in constant alert response, and also due to insomnia, which can cause fatigue. Other mental health issue, depression and anxiety, as well as fibromyalgia, chronic migraines, tension headaches, even hives can be caused by stress reaction and acne. So how do we counter the chronic stress response, which is important? Now that we know the danger or the very negative effects that this chronic stress response have in all our organ system, how do we activate the rest and digest system, the parasympathetic nervous system, so that we can achieve our health, happiness, longevity, and resilience? Learn how to do this on a daily basis, help you get there. The main hormones in the system are acetylcholine, I call it the brake fluid, as above, dopamine, the reward system, main ingredient, which you can get from using harmful drugs, or you can do the following things that I mentioned below. Oxytocin, which is called the loving, cuddling hormones. And I mentioned that before when I talked about animal. When we pet an animal or we hug another animal or a human being, your body releases oxytocin, or when mom breastfeeding a baby, both mom and baby make the oxytocin hormones. Melatonin, which is important for sleeping and resting, and also endorphin as well. And this system, which is the stress, rest, and digest system, is your friend. And we need to keep it activated or active on our daily lives when there is no emergency situation. There are many ways you can keep the rest system active and activated daily. Physical activities has been shown to increase both deep breathing and reduce muscle tension, both of which keep the rest and digest system activated, while improving lean body mass, burning fat, reducing weight, blood pressure, heart rate, and blood sugar for diabetic patients, as well as all the negative effects that we mentioned above caused by the chronic stress system. Some examples include doing yoga, meditation, Tai Chi, Pilates, Qigong, or go for a run, taking a walk with anyone or your animal, physical activities, and these can all activate the rest system for you. And I found that doing yoga before working out reduce injuries from these workout and other physical activities. So that's important. Another component is social support, and it's been shown and proven that this is essential for any happiness or good health, mentally and physically. And I have talked about the practice of kinship, which is the practice of building connections with everyone or everything, or even animal that you encounter on your daily lives, with your colleagues at work, as a healthcare worker, with your patients, and also with your family and friends. But the most important connection that you have to make first is with yourself, to find that self-compassion, self-acceptance, and self-kindness, as I talked about in episode 1, is an important prerequisite to build a kinship system for yourself. So all started from there. So bottom line is that spend every day of your life to invest in the activities and also kinship building, of connection building, in order to keep your rest and digest system active all day long, every day, unless there is an emergency situation or life-threatening situation that arise, which is rare for any one of us. Keep that effort every day so that you can keep the rest and digest system active every day. I talk about that during my episode about how to have a good work day, is to work and manage your shift before the shift start and during the shift, in order to stay in the parasympathetic nervous system mode of rest and digest. And at the end of the shift, you will not be emotionally or physically exhausted. That's one example. But long term, if you do this every day, you get that resilience, longevity, health, and happiness also. How do you apply what you learn into a stressful situation to optimize your performance? All the great athletes, performers like Michael Jordan, Tom Brady, David Ortiz, a big poppy for the Red Sox, and many other athletes from other teams. I'm biased here. I apologize. Have mastered this skill of using just the right amount of energy or increased energy generated during a stressful event, to optimize their performance instead of making it worse. Not only they can do that, but all these great performers and athletes have the ability to raise the performance of their teammates also. That's what makes them great. How do they do this? They recognize their body's physical responses, a racing heart rate, bitter taste, butterflies in your stomach. Keep breathing while observing these physical sensations generated by stress. The key is, do not deny the stress that's present, but recognize that it in a normal physical response to a high pressure situation. Focus on suffering of others. Help suppress your own overwhelming stress response. Also, focus on the big picture. Say if you are stuck in the traffic because you want to keep the good job you have. Also, as I mentioned in previous episode of the series about how to face heartbreaks and hardship without being broken and hard, use those techniques and response that you learn from those episodes when you have these stressful situation, and also focus on what you can learn from this stressful response in a positive way. It can give you more energy and strength. It teaches you a lesson on adversity. It enables you to connect with others or makes you feel more alive. Another strategy to use during the stressful situation is use the strategy STOP, S-T-O-P, to give yourself a 1-minute breathing space when you feel overwhelmed, wherever the situation is, at work, at home, when things are escalating and out of control. If you can put a pause and practice the technique, it may be very helpful to allow you to de-escalate the situation and allow you to see things more clearly and come up with a resolution that is optimal. for everyone. S is for stop and take a stock of what is my experience right now, what my thoughts are, what comes to mind about the situation, feelings that I'm having, enjoying, neutral, upset, excited, and then physical sensations such as dry mouth, tight muscles, and so on. T stands for take a breath, a direct, give full attention to each breath into your nose, out to your mouth, or you can use a 7-4-8. Inhale, count to 7, hold for 4, breathe out 8, into your nose, out to your mouth. To stay present in the moment and be mindful. O stands for open and observe. Once you've done focusing on your breath and continue to do that, you can expand your observation beyond your breathing to your posture, your facial expression, and also the exterior sight and sound. E stands for proceed with also new possibilities. Be curiously open about the world around us, sensing how things are right now, and respond naturally with kindness. So those are the techniques that you can use to apply when there is overwhelming stress and you feel like you're running out of control. Practice the stop STOP strategy to give yourself a 1-minute breathing space. And also practice what the great athletes or performers use during a stressful situation to optimize and elevate their performances. But more importantly, every day practice and dedicate and invest in keeping your rest and digest system active. This takes time and it takes work. And if you stop doing that, life will bring you right back to the dominating fight or flight mode. And that is something that will ruin your health and happiness and cause illnesses and lead to you breaking down or decompensating. Please practice that every day for the rest of your life to stay in the rest and digest system. Please follow me to the next episode about this series, which will be on next Sunday when I interview Laura and how she has been able to use her lifestyle changes to keep her rest and digest system active and allow her to find happiness, good health, self-compassion, self-acceptance, and overall become a lot more resilient with her job and job situations. So hopefully you'll catch that episode. And thank you for your time tuning into this episode, and take care.